time for a look at health news now. The Therapeutic Goods Administration has approved Pfizer's paediatric dose of its COVID vaccine for children aged between 6 months and 5 years old. Here's Dr. Norman Swan from the RN Health Report.
Well, Moderna was approved before that, and ATAGI has recommended that the vaccine be available initially for kids of that age, babies and toddlers and preschoolers who are at risk of severe COVID. So that's immunocompromised, heart disease, type 1 diabetes and so on. So it's not generally available there. And my understanding is that the rollout is, if it hasn't already started, it's imminent for that age group. And the assumption would be that Pfizer would get the same approval from ATAGI, given that they're very similar vaccines. The question is when it becomes generally available for 6 months to 5 years, and that's up to ATAGI to approve.
Now, you have a story on 7:30 tonight about the scrapping of the COVID isolation period. Who are you talking to?
So we're talking to an international authority on viruses and viral evolution, Ian Lipkin from Columbia University, and he is one of the people we're talking to, and he basically argues this is a pattern around the world where people say we're fed up with COVID, we want to get beyond it. Politicians are virtually saying it's over, even though the chief medical officer here did not say it was over, and we'll put this back on personal responsibility. And it's just quite clear it's not over. Number of cases in Germany has doubled in the last week. There are lots of new variants out there which will evade immunity and evade the vaccine. The question is how it will affect us. And we've already seen that there's been 13,000 deaths this year. Even last week there were 252 deaths reported, and that's more than one Bali bombing. So we're still in the middle of a pandemic which is not showing any signs of going away. And the question is, which we'll ask tonight on 7:30, is whether the messaging has just been wrong and whether you're asking too much of personal responsibility if you're telling people virtually it's over, don't worry about it, rather than this is serious and we need to get organised, and if you haven't had your third dose, get it.
Okay, Dr. Norman Swan, you'll have more on 7:30 tonight. Thank you.